Hi everyone! So I created this video to share some information with you about the herpes simplex virus, also known as HSV. There are two subtypes of HSV. The first subtype is herpes simplex virus type 1, also known as HSV1, and the second subtype is herpes simplex virus type 2, also known as HSV2. It is important to know that both HSV1 and HSV2 can manifest in different regions of the body, including the oral region and the genital region. When a person is exposed to HSV for the first time, it is called the primary infection. The primary infection occurs when the virus invades epithelial cells through a break in the skin. The virus then travels to the dorsal root ganglion by retrograde axonal transport. Upon reaching the dorsal root ganglion, the virus establishes lifelong latency. Recurrent infections occur when the virus reactivates and travels to the original infection site by way of the peripheral nerve. This explains why infections emerge in the same place time and time again. Causes of reactivation include exposure to ultraviolet light, fatigue, fever, menstruation, skin irritation, and stress. HSV1 usually establishes latency in the trigeminal ganglia, thus it is the most common cause of oral infections such as cold sores or fever blisters, and corneal infections such as herpes keratitis. But don't forget, HSV1 can cause genital infections. HSV1 is highly contagious and is usually spread by contact with infected saliva or skin. When an infection is present, it is important not to kiss, touch the infection, or share objects that have been in contact with the infection or the saliva. Prior to the formation of HSV1's characteristic lesions, the affected area may become sensitive, burn, or feel numb and tingly. The lesions then present as clusters of vesicles or as a rash. The vesicles are inflamed and painful, in which they rupture and crust over. The lesions typically resolve within 2 to 6 weeks. HSV2 usually establishes latency in the lumbosacral ganglia, thus it is the most common cause of genital infections. But don't forget, HSV2 can cause oral infections. HSV2 is usually spread by sexual contact during viral shedding. The use of condoms and the disclosure of HSV infection status among partners can reduce the risk of HSV2 transmission. HSV2 can also spread by vertical transmission from a mother to her baby. A baby with HSV2 may suffer severe neurological complications and even death. The lesions of HSV2 present as small vesicles and within 3 to 4 days advance to ulceration, in which they will itch, ooze, and become painful. The diagnosis of HSV is aided by laboratory studies such as antibody testing, culture, immunofluorescence, polymerase chain reaction, PCR, and Zonk smears. Antibody testing can confirm primary infection when a patient has negative HSV antibodies and positive viral cultures. Antibody testing, however, cannot generally distinguish between HSV1 and HSV2. Culture, specifically tissue culture, is the standard method for confirming HSV. Tissue culture can distinguish between HSV1 and HSV2, and it can produce results within 48 hours of inoculation. Immunofluorescence can distinguish between HSV1 and HSV2 when cells scraped from ulcerations are stained with direct fluorescent antigen. PCR assays are more sensitive than tissue cultures and are preferred when testing for central nervous system, genital, and ocular infections. When a patient has symptoms of encephalitis, PCR using cerebral spinal fluid is a quick and non-invasive test. Zonk smears can confirm cytologic changes caused by HSV. Zonk smears, however, cannot distinguish between HSV1 and HSV2. Treatment for HSV1 is symptomatic. Oral antiviral agents may be used prophylactically or at the onset of the infection, and topical antiviral agents may be used throughout the course of the infection. Treatment for HSV2 is also symptomatic and includes oral or topical antiviral agents. That concludes my presentation. Thank you so much for watching, and I hope you learned something new.